Welcome to An Apple a Day, a podcast, a resource, a community. Share your experiences and learn from others as we overcome barriers and learn to live a happy and healthy life. Not as disabled people, but as people with a disability. Welcome to the community. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. How you feeling today, my friend? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. We've got a good one for you today. Today I'm talking about a lifelong mood disorder. That's right, lifelong. It stays with you. It's called bipolar disorder. It's a chronic mood disorder that causes intense shifts in mood, energy levels, and behavior. Manic and hypomanic episodes are the main sign of the condition, and most people with bipolar disorder also have depressive episodes. The condition is manageable with medications, talk therapy, and lifestyle changes and other treatments. Like I said, this is a lifelong mood disorder. This isn't something that's going to go away. It's not contagious, although it's genetic. If someone in your family suffers from this, you can inherit it. It's not guaranteed that you'll inherit it, but you can. And we're going to discuss this. It's very interesting and it's important, especially if it runs in your family. So sit back, relax, and listen to what Dave has to tell us about bipolar disorder.
What is bipolar disorder? Bipolar disorder, formerly known as manic-depressive illness or manic depression, is a lifelong mood disorder and mental health condition that causes intense shifts in mood, energy levels, thinking patterns and behavior. These shifts can last for hours, days, weeks or months and interrupt your ability to carry out day-to-day tasks. There are a few types of bipolar disorder, which involve experiencing significant fluctuations in mood referred to as hypomanic, manic and depressive episodes. However, people with bipolar disorder aren't always in a hypomanic, manic or depressive state. They also experience periods of normal mood, known as euthymia. A key feature of bipolar I disorder is manic episodes. To meet the criteria for bipolar I disorder, you must have had at least one manic episode in your life for at least a week with or without ever experiencing a depressive episode. Mania is a condition in which you have a period of abnormally elevated or irritable mood, as well as extreme changes in emotions, thoughts, energy, talkativeness and activity level. This highly energized level of physical and mental activity and behavior is a change from your usual self and is noticeable by others. People who are in manic states may indulge in activities that cause them physical, social or financial harm, such as suddenly spending or gambling extreme amounts of money or driving recklessly. They also occasionally develop psychotic symptoms, such as delusions and hallucinations, which can cause difficulties in distinguishing bipolar disorder from other disorders such as schizophrenia or schizoaffective disorder. People with certain types of bipolar such as bipolar II disorder experience hypomania, which is a less severe form of mania. It doesn't last as long as manic episodes and it doesn't interfere with daily functioning as much. During a depressive episode, you experience a low or depressed mood and or loss of interest in most activities, as well as many other symptoms of depression, such as tiredness, changes in appetite, and feelings of worthlessness and hopelessness. In the last few decades, the medical world, especially the field of psychiatry, has intentionally made a shift from using manic depressive illness, or manic depression, to describe bipolar disorder. There are several reasons for this shift, including, healthcare providers used to use manic depression to describe a wide range of mental health conditions. As mental health condition classification systems, including the Diagnostic and Statistical Manual of Mental Disorders, DSM, have become more sophisticated, the new term, bipolar disorder, allows for more clarity in diagnosis. There's a lot of stigma and negativity associated with the terms manic and mania, especially due to the use of maniac. Similarly, people use the term depression casually to describe periods of sadness that don't qualify as clinical depression. Using bipolar disorder takes the focus away from these two words. Bipolar disorder is more of a clinical, medical term and less emotionally loaded than manic depression. The term manic depression excludes the cyclothymic or hypomanic, bipolar II disorder versions of the condition. There are 4 types of bipolar disorder, including bipolar I disorder. People with bipolar I disorder have experienced one or more episodes of mania. Most people with bipolar I will have episodes of both mania and depression, but an episode of depression isn't necessary for a diagnosis. The depressive episodes usually last at least 2 weeks. To be diagnosed with bipolar I, your manic episodes must last at least 7 days or be so severe that you need hospitalization. People with bipolar I can also experience mixed states, episodes of both manic and depressive symptoms. Bipolar II disorder. People with bipolar II experience depressive episodes and hypomanic episodes. But they never experience a full manic episode that's characteristic of bipolar I disorder. While hypomania is less impairing than mania, bipolar II disorder is often more debilitating than bipolar I disorder due to chronic depression being more common in bipolar II. Cyclothymic disorder. Cyclothymia. People with cyclothymic disorder have a chronically unstable mood state. They experience hypomania and mild depression for at least 2 years. People with cyclothymia may have brief periods of normal mood, euthymia, but these periods last fewer than 8 weeks. Other specified and unspecified bipolar and related disorders. If a person doesn't meet the diagnostic criteria for bipolar I, II or cyclothymia but has still experienced periods of clinically significant abnormal mood elevation, it's considered other specified or unspecified bipolar disorder. While borderline personality disorder, BPD, and bipolar disorder have similar symptoms and are often confused for each other, they're distinct conditions. BPD involves a long-standing pattern of abrupt, moment-to-moment swings in moods, behavior and self-image that are often triggered by conflicts in interactions with other people. Non-suicidal self-injury is also common in BPD but not in bipolar disorder. Bipolar disorder is different from BPD because it involves distinct, longer-lasting episodes of mania, hypomania and/or depression. Several things can trigger manic or depressive episodes, such as sleep changes, stress, medications and substance use. Bipolar disorder can affect anyone. The average age of onset is 25 years, but, more rarely, it can start as early as early childhood or as late as in your 40s or 50s. Although bipolar disorder affects people assigned female at birth, AFAB, and people assigned male at birth, AMAB, in equal numbers, the condition tends to affect them differently. People AFAB with bipolar disorder may switch moods more quickly. When people with bipolar disorder experience 4 or more manic or depressive episodes in a year, this is called rapid cycling. Varying levels of sex hormones and thyroid hormones, together with the tendency for people AFAB to be prescribed antidepressants, may contribute to the more rapid cycling in this population. People AFAB with bipolar disorder may also experience more periods of depression than people AMAB. Bipolar disorder affects approximately 5.7 million adult Americans or about 2.6% of the U.S. population. The defining sign of bipolar I disorder is a manic episode that lasts at least 1 week, while people with bipolar II disorder or cyclothymia experience hypomanic episodes. But many people with bipolar disorder experience both hypomanic, manic and depressive episodes. These changing mood states don't always follow a set pattern, and depression doesn't always follow manic phases. A person may also experience the same mood state several times, with periods of euthymia in between, before experiencing the opposite mood. Mood changes in bipolar disorder can happen over a period of weeks, months and sometimes even years. An important aspect of the mood changes is that they're a departure from your regular self and that the mood change is sustained for a long time. It may be many days or weeks in the case of mania and many weeks or months in the case of depression. The severity of the depressive and manic phases can differ from person to person and in the same person at different times. Some people with bipolar disorder will have episodes of mania or hypomania many times throughout their life. Others may experience them only rarely. Signs and symptoms of a manic episode include excessive happiness, hopefulness, and excitement. Sudden and severe changes in mood, such as going from being joyful to being angry and hostile. Restlessness. Rapid speech and racing thoughts. Increased energy and less need for sleep. Increased impulsivity and poor judgment, such as suddenly quitting your job. Making grand and unattainable plans. Reckless and risk-taking behavior, such as drug and alcohol misuse and having unsafe or unprotected sex. Feeling like you're unusually important, talented or powerful. And psychosis, experiencing hallucinations and delusions, in the most severe manic episodes. Most of the time, people experiencing a manic episode are unaware of the negative consequences of their actions. With bipolar disorder, suicide is an ever-present danger. Some people become suicidal in manic episodes, not just depressive episodes. If a person is having an intense manic episode, especially if they're experiencing hallucinations and delusions, they may need to be hospitalized to protect themselves and others from possible harm. Some people with bipolar disorder have milder manic-like symptoms. This is called hypomania. With hypomania, you may feel very good and find that you can get a lot done. People with hypomania can often function well in social situations or at work. You may not feel like anything is wrong during a hypomanic episode. But your family and friends may notice your mood swings and activity level changes and think that they're unusual for you. After hypomania, you might experience severe depression. The symptoms of depressive episodes in bipolar disorder are the same as those of major depression. They include overwhelming sadness, low energy and fatigue, lack of motivation, feelings of hopelessness or worthlessness, loss of enjoyment of things that were once pleasurable for you. Difficulty concentrating and making decisions. Uncontrollable crying. Irritability. Increased need for sleep. Insomnia or excessive sleep. A change in appetite, causing weight loss or gain. And even thoughts of death or suicide, suicidal ideation. If you're experiencing suicidal ideation, thoughts of suicide, it's important to seek immediate care. Call 911 or the Suicide and Crisis Lifeline at 988. Someone will be available to talk with you 24 hours a day, 7 days a week. The symptoms of a mixed episode include both manic and depressive symptoms together. During a mixed episode, you have the negative feelings and thoughts that come with depression but also feel agitated, restless and high energy. People who experience mixed episodes often describe it as the worst part of bipolar disorder. Scientists don't yet know the exact cause of bipolar disorder. But they do believe there's a strong genetic component. Bipolar disorder is considered one of the most heritable psychiatric conditions. More than 2/3 of people with bipolar disorder have at least one close biological relative with the condition. However, just because you have a biological relative with bipolar disorder, doesn't necessarily mean you'll also develop it. Other factors that scientists think contribute to the development of bipolar disorder include changes in your brain. Researchers have identified subtle differences in the average size or activation of some brain structures in people with bipolar disorder. However, brain scans can't diagnose the condition. Environmental factors like trauma and stress. A stressful event, such as the death of a loved one, a serious illness, divorce or financial problems can trigger a manic or depressive episode. Because of this, stress and trauma may also play a role in the development of bipolar disorder. Scientists are currently performing research to determine the relationship that these factors have in bipolar disorder, how they may help prevent its onset and what role they may play in its treatment. Unfortunately, there's no known way to prevent bipolar disorder because scientists don't know its exact cause. But it's important to know the signs and symptoms of bipolar disorder and to seek early intervention. Bipolar disorder is a lifelong illness. But long-term, ongoing treatment, such as medication and talk therapy, can help manage your symptoms and enable you to live a healthy, purposeful life. It's important to see your healthcare team regularly to monitor your treatment plan and symptoms. Know that your healthcare providers and loved ones are there to support you. I hope you found this interesting and informative. I'm gonna pass this back to Jimmy. Have a beautiful day.
Thanks, Dave. And thank you to the listener for being here today. I really appreciate it. Hey, do yourself a favor today. Give someone a compliment. Make their day. And you're going to find out giving a compliment is like eating a potato chip. You can't just do it once. You're going to want to do it again and again once you see their reaction. Give someone a compliment today. Make them feel good. It's going to make you feel good. And remember this, my friends. Things can always be worse. That's right. Right now, there's somebody somewhere wishing that they were in your position. So things can always be worse. You've been listening to an Apple a Day's The Fritter. And I'm your host, Jimmy Apple. And I just have to tell you, I'm not supposed to tell you, but I have to let it out of the bag. Big things are coming to the podcast. You wait and see in the next couple of weeks. Big things are going to be happening. I can't tell you much, but the format might be changing a little bit. So stick around, and I'll talk to you again real soon. Have a great day today, my friends.
Thanks for listening to An Apple a Day with Jimmy Apple, your gateway to a happy, healthy life. Join our community at www.famousapple.com. See you next time.